The third trimester of pregnancy is an exciting, yet often challenging, time as you prepare to meet your baby. As you enter these final months, your body is undergoing significant changes, and your baby is rapidly growing and developing. This period is filled with anticipation, preparation, and sometimes a bit of discomfort as you count down the days to delivery. In this comprehensive guide, we'll cover literally everything you need to know about the third trimester, from what to expect in terms of physical changes and common symptoms, to tips on preparing for labor and delivery, and advice on how to take care of yourself during this crucial time. Let's dive in. What exactly is the third trimester? The third trimester begins at week 28 of pregnancy and lasts until you give birth, which typically happens around week 40. However, full-term pregnancies can range from 37 to 42 weeks. During this trimester, your baby will grow from about 2.5 pounds to somewhere between 6 and 9 pounds or more, and your body will continue to change in preparation for childbirth. Physical changes and symptoms. As your baby grows, you'll likely experience a variety of physical changes and symptoms. Here's what to expect. Number 1. Growing belly. Your belly will continue to expand as your baby gains weight. You might notice that your baby drops or moves lower into your pelvis in the last few weeks, which is a sign that your body is preparing for labor. Number 2. Shortness of breath. As your uterus expands, it can put pressure on your diaphragm, making it harder to breathe deeply. This is common, especially as you near the end of your pregnancy. Number 3. Back pain. The extra weight you're carrying, combined with the shift in your center of gravity, can lead to back pain. Stretching, prenatal yoga, and wearing supportive shoes can help alleviate some of this discomfort. Number 4. Braxton Hicks contractions. These are practice contractions that your body uses to prepare for labor. They are usually irregular and not painful, but they can be uncomfortable. If they become regular or painful, contact your healthcare provider as it could be a sign of preterm labor. Number 5. Swelling or edema. Mild swelling in your feet, ankles, and hands is common in the third trimester, especially after standing for long periods. However, sudden or severe swelling, particularly in your face or hands, could be a sign of preeclampsia, a serious pregnancy complication, and should be reported to your doctor immediately. Number 6. Heartburn and indigestion. As your baby grows, there's less room in your abdomen, which can push stomach acids up into your esophagus, causing heartburn. Eating smaller, more frequent meals and avoiding spicy or fatty foods can help manage this symptom. Number 7. Frequent urination. As your baby moves lower into your pelvis, they may press on your bladder, leading to more frequent trips to the bathroom. Number 8. Fatigue. It's normal to feel more tired as your body works hard to support your growing baby. Rest when you can and prioritize sleep by creating a comfortable sleeping environment. Number 9. Nesting instinct. Many women experience a burst of energy and an overwhelming desire to clean and organize their home in preparation for the baby. While it's fine to get ready, remember to pace yourself and not overdo it. Baby's development in the third trimester. Your baby's development during the third trimester is rapid and crucial for their arrival into the world. Here's a breakdown of what's happening. Week 28 to 32. Lung development. Your baby's lungs are continuing to mature, preparing them to breathe on their own after birth. Brain growth. Brain is rapidly developing, increasing in both size and complexity. Weight gain. Your baby is gaining fat, which will help regulate their body temperature after birth. Week 33 to 36. Positioning. By this time, most babies settle into a head-down position in preparation for birth. If your baby is breech or feet or buttocks down, your doctor might discuss options to encourage them to turn. Sleep patterns. Your baby is developing more defined sleep patterns, including REM or rapid eye movement sleep, which is associated with dreaming. Senses. Your baby's senses are fully developed, and they can respond to light, sound, and touch. Week 37 to 40. Full term. By 37 weeks, your baby is considered full term. Their organs are mature, and they are ready to survive outside the womb. Final preparations. Your baby will continue to gain weight, and their skin will become less wrinkled as they accumulate fat. Engagement. Your baby may engage or drop lower into the pelvis in the last few weeks, especially if this is your first pregnancy. Preparing for labor and delivery. As you enter the final stretch, it's important to start preparing for labor and delivery. Here's how you can get ready. Number 1. Create a birth plan. A birth plan is a document that outlines your preferences for labor and delivery, including pain management, who you want in the room, and any special requests. While it's important to be flexible, having a plan can help you feel more in control. Number 2. Pack your hospital bag. Around week 36, it's a good idea to pack your hospital bag with essentials like comfortable clothing, toiletries, baby clothes, and any important documents. Don't forget items like snacks, a phone charger, and a birth plan if you have one. Number 3. Take a childbirth class. If you haven't already, consider taking a childbirth class to learn more about the stages of labor, pain management options, and what to expect during delivery. Many classes also cover breastfeeding and newborn care. Number 4. Prepare for breastfeeding. If you plan to breastfeed, now is a good time to educate yourself about breastfeeding techniques, potential challenges, and how to get support if needed. Consider getting a comfortable nursing bra and some nipple cream to help with any initial discomfort. Number 5. Get your home ready. Prepare your home for the baby's arrival by setting up the nursery, washing baby clothes, and stocking up on essentials like diapers and wipes. You might also want to prepare some meals in advance to make the first few weeks after birth a bit easier. Caring for yourself in the third trimester. Taking care of yourself during the third trimester is crucial for your health and your baby's. Here are some tips. Number 1. Eat a balanced diet. Continue to eat a healthy, balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. Staying hydrated is also essential, so drink plenty of water throughout the day. Number 2. Stay active. While it's important to listen to your body and not overdo it, staying active can help with circulation, reduce swelling, and improve your mood. Prenatal yoga, walking, and swimming are all great options. Number 3. Rest when you can. As your due date approaches, make sleep a priority. Try to get comfortable with pillows supporting your belly and legs, and consider taking short naps during the day if nighttime sleep is challenging. Number 4. Manage stress. It's normal to feel a bit anxious as you prepare for labor and motherhood. Practicing relaxation techniques like deep breathing, meditation, or prenatal massage can help manage stress and keep you calm. Number 5. Monitor your health. Continue attending all prenatal appointments to monitor your health and your baby's. Be aware of any warning signs that require immediate attention, such as severe headaches, sudden swelling, or a decrease in fetal movement. Number 6. Stay connected. Maintain open communication with your partner, family, and friends. Their support will be invaluable as you navigate the final weeks of pregnancy and prepare for the big day. Signs of labor: what to watch for. As you approach your due date, it's important to be aware of the signs of labor. Here are some key indicators that labor may be starting. Number 1. Regular contractions. Unlike Braxton Hicks contractions, which are irregular, true labor contractions are consistent, increasing in intensity and frequency over time. If you're having regular contractions that don't go away, it's time to call your doctor or head to the hospital. Number 2. Water breaking. When the amniotic sac ruptures, it can feel like a gush of fluid or a slow trickle. This is a clear sign that labor is imminent, and you should contact your healthcare provider right away. Number 3. Mucus plug. You may notice a thick, jelly-like discharge, which could be clear, pink, or slightly bloody. This is the mucus plug, which seals the cervix during pregnancy and is released as the cervix begins to dilate. Number 4. Lightening. This refers to your baby dropping lower into the pelvis, which can happen a few weeks or just hours before labor begins. You may feel increased pelvic pressure and a need to urinate more frequently. Number 5. Effacement and dilation. Your healthcare provider will check for effacement or thinning of the cervix and dilation or opening of the cervix during your prenatal visits. These changes indicate that your body is preparing for labor. The final countdown. The third trimester is a time of anticipation, preparation, and often a bit of discomfort. But it's also a time of excitement as you get ready to meet your baby. By understanding what to expect, how to take care of yourself, and how to prepare for labor and delivery, you can approach the final weeks of pregnancy with confidence. Remember to listen to your body, stay connected with your healthcare provider, and reach out for support when you need it.